So what is type 1? It is injury to the growth plate plus, means there is injury to the growth plate only. That means only a linear fracture is there, linear breakdown is there in any different zones of the growth plate. Now, there might be a secondary question that out of these 5 different zones of the growth plate, which one is more commonly affected? You know, hypertrophic is the weakest zone, because hypertrophic is the weakest zone of the growth plate. So it is most commonly affected in this one. All right, because it is considered to be the weakest zone of the growth plate. Now, type 2 is that there is injury to the growth plate plus metaphysis. Now, there is not only injury to the growth plate, but there is a associated injury to the metaphyseal bone also. And it is not very difficult to understand. Imagine if this is a bone and here we are talking about any injury to the bone or any injury to the growth plate, which is also involving the metaphysis, then it would be called as type 2 fractures or type Salter-Harris type 2 injury. Now, in this metaphyseal injury, what there is a specificity is that when the metaphysis is injured, it is responsible for the creation of a fragment which could be separated from the parent bone. And the name of this fragment is a Thurston-Holland fragment. And you see, this question has been asked in multiple of the frames, like Thurston-Holland fragment, which of the following is correct, or Thurston-Holland fragment, which of the following is incorrect. Like Thurston-Holland fragment is a feature of, and you are provided with 4 options: Salter-Harris type 1, type 2, type 3 or type 4 injury. So what is the answer? It is a feature of type 2 injury. Then second is Thurston-Holland is a metaphyseal, epiphyseal, diaphyseal or a growth plate fragment. Answer for that question is it is a metaphyseal fragment. Then comes the type 3. Now in type 3 injury, it will be an injury to the growth plate plus epiphysis. So you see what we have discussed the injury to the growth plate itself, we have discussed the injury to the growth plate and metaphysis, and this time what we are witnessing over here is an injury to the growth plate extending onto the epiphyseal region. Alright, so that is type 3. So obviously what is going to be type 4? The type 4 injury would be injury to the growth plate, because now the mechanism of injury is increasing, the severity of trauma is increasing. So it will be an injury to the growth plate plus injury to the metaphysis, while there will be an injury to the epiphysis also. Alright, so injury to the growth plate plus epiphysis and metaphysis, that is type 4. So it is not very difficult to understand here also. So what will be there in type 4? There will be injury to the growth plate, metaphysis and epiphysis. So it is type 4, this is type 2 and this is type 3. So what you can expect is that out of these 4 different types of injuries, as it is very clearly evident that type 1 would be having the best prognostic outcome, while type 4 would be having the worst prognostic outcome based on these type 4 only. But there is an additional type 5th injury to the growth plate also. And what is that? The type 5th injury is a crush injury to growth plate. That means the growth plate gets crushed in between the epiphyseal and the metaphyseal fragment. And this is considered to have the worst prognostic outcome out of the 5 different types of primarily classified Salter-Harris system of Salter-Harris injuries to the growth plate. So this type 5th would be having the worst prognosis, and type 1 obviously would be having the best prognosis. Hope this point is clear. So there could be multiple questions that could be framed out of this prognostic significance itself, like which of the following injury in a child of a bone of a child would be having the worst prognostic outcome, and they can give you the options like injury to the growth plate, injury to the growth plate and epiphysis, the crush injury, injury to the growth plate plus metaphysis. Likewise, the options could be displayed and you are aware that which one would be having the worst prognostic outcome. Now, you know, there is an additional injury also, or there is an additional system of classifications also. Like primarily Salter-Harris gave 5 systems, 5 types, but later on there was an addition of type 6, and type 6 was not given by Salter-Harris, it was given by Rang. The name of the individual is Rang. And what is type 6 injury? It is injury to the perichondrial ring. Now you will ask, what is perichondrial ring? Actually, it is a support to the growth plate. It is a fibrous support to the growth plate. So if there is an injury to the bone, then directly the growth plate could not be affected. The support to the growth plate could only be affected. Then it would be called as injury to the perichondrial ring. Alright, that is type 6. So what is perichondrial ring? It is a support to growth plate having its own consequences. So hopefully everything is clear related to Salter-Harris system of classification. As I told you that the fracture in case of a child which is involving a growth plate would be having different impact. It might impact the growth of the bone also. In length of the bone could be affected. That is why it is classified by a separate system, that is Salter-Harris system. Now over to it there are other additions also, like there is type 7th also, type 8 also, type 9, but you need not to waste your time because it is not going to be asked. Whatever they are going to ask the question based on, it will be a primary classification given by Salter-Harris. Now, if you answer this question that which of the following is true for the pattern of the injury which is provided to you in the X-ray. Now, if you look closely at the X-ray, by this time you are already aware of the fact that this is the X-ray of the ankle joint and this is the AP view while this is the lateral view. Now, what in the form of a gap is visible over here? Obviously, this is not the fracture. It is a growth plate. That means the distal growth plate of the tibia. Similarly, here we are having a distal growth plate of the fibula. And if we concentrate on the AP view, there is no fracture line visible. But if you look at the lateral view, then there is a clear-cut fracture line visible in the lateral view. This is the fracture line. Now, this fracture line is involving epiphysis or metaphysis. It is involving the metaphysis. That means if you are considering there is a fracture or there is a breakdown of a growth plate along with the metaphysis, that means is it type 1, type 2 or type 3 injury? Answer for that question, it is type 2 injury, where there is a growth plate injury involving the metaphysis. And it is also very clearly evident now that is it not creating a fragment which is slightly separated from the parent bone in the metaphyseal region. So yes, there is a creation of a fragment which is slightly separated from the parent bone, and the name of this fragment, because this fragment is a named fragment, it is Thurston-Holland fragment. This is also we have discussed. Alright, so hope everything is clear related to this Salter-Harris system of classification. So a quick revision of what we have talked about. We have talked about the introduction of the growth plate, the function of growth plate, the identification of a growth plate, and based on identification, the possible age group the patient could be, the patient is having. Second, we have talked about the different zones and their alignments. Then we have talked about the injury to the growth plate in the form of Salter-Harris system of classification by giving you a sample X-ray where there is a fracture involving the growth plate and the metaphysis. Answer for that question is Salter-Harris type 2. So hope everything is clear related to this. This is the introductory part of the orthopedics that we have talked about.